what exactly to expect from a typical facelift scar and its appearance. This is one of my surgical cases, a patient who had undergone a facelift 2 years ago. We went in to redo the surgery, and this is a scar that became widened, probably because it was under tension, and it's what we call a pre-hairline scar. This is the scar behind the ear, and it follows the hairline. Here at the clinic, Eduardo and I don't like this type of scar. We think it ends up being very visible. Normally, when we make the incisions, we place the scar within the hairline. In our opinion, it stays more hidden, and when the patient ties their hair up later, after surgery, a year later, you can hardly see the mark from the scar. In this patient's case, this was a photo we took to prepare for the surgery. And in this case, we tried to reposition the scar in the right place where it would be more aesthetically appropriate. And I wanted to show a few more details that we also try to avoid when performing a facelift surgery. The first of these is the removal of the sideburn. When we draw the markings, right? Sometimes we need to extend the scar a little bit more. And one precaution we always take is not to remove the sideburn. The sideburn is this little patch of hair we have in front of the ear. Normally, the sideburn should be, at most, at the level of where the ear attaches. So the ear has several anatomical features, and there's a point where it attaches to the skull. So the sideburn can't be above the point where the ear attaches. Normally, it sits just a little below. It doesn't need to be very low, but it can't be cut off. It can't be too straight in this area. Otherwise, it creates what we call a surgical stigma. When we look at the patient, we can tell they've had surgery. Another stigma is the loss of the tragus. Personally, I really like the retrotragal scar. As I mentioned to you, we usually follow the anatomical features. However, this anatomical feature, which is the tragus, that little bump in front of the ear, it needs to remain visible. And when you bring a flap, when you bring very thick skin over it, you end up causing it to disappear. These are small details that we pay attention to, and they contribute to the naturalness and quality of the results. And the third point I also pay attention to in this case, I'm quite critical. Most people aren't like this, but I'm very critical of my results, especially when I'm going to reoperate on a patient, is the notch in the earlobe. There are some patients who end up with an embedded earlobe where the lobe isn't free and loose, the way it should be for wearing earrings. And in this case, for example, it was a patient who could have had a lobe reduction, which is a rejuvenation of the earlobe, so it doesn't end up with those folds. And that's what was done today in this case. We can't bring the sideburn down, but we made sure to keep it from getting any higher. We created a small peninsula. For the tragus, we tried to make the flap a little thinner, and we performed a reduction of the earlobe. And for the scar behind the ear, we tried to remove the old scar and place it in a better position. Now I'm going to stop talking about the negative aspects and show you what's good, which is what we consider good healing. Here is an image of a scar, right? Which goes all the way to the area behind the ear. And when the patient has her hair tied up, you can see there's a shadow, but it's almost not visible at all. And it goes into the hair. It doesn't stay in front of the hairline. In this way, it looks more aesthetically pleasing and is more concealed. Usually the height of the retroauricular scar is more or less at the level of the tragus. So when we draw the scars to perform the surgery, we already have this in mind, and that's how it's done. The marking of the incisions. Another detail you can see in this well-positioned scar is that the sideburn is at the level of the ear's insertion, which is what we expect from a sideburn. It can't be too high. It can be a little lower or right at this insertion line. And the tragus, which is this anatomical feature, is visible in this patient. The earlobe is free and the scar goes unnoticed when the patient has her hair down. Up. So, usually when patients come in for facial lifting consultations, it's very common for them to ask me, "Doctor, won't the scar be very visible? Won't it be too apparent?" And actually, when we follow these small principles of how to make the scar and we don't leave the scar under tension, the tendency is that after a month, 40 days, it already starts to become less noticeable. And around the 4th to 6th month, it's practically unnoticeable. You really have to look very closely to notice that there's a cut or a surgical scar there. So as a rule, it's a region that heals very well and whose scars are of excellent quality. So I think it's interesting to bring these real-life cases so you can understand how our day-to-day really works. how we view this procedure and what can be done by following anatomy, following anatomical principles, and how we can really achieve an aesthetic result that is pleasing and not noticeable. The overall result is so good that the small mark left as a consequence isn't something that will genuinely bother the patient over a significant period of time. So that was today's message. Everyone, have an excellent week with lots of health for all. A big kiss and see you next Monday. Bye.